This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and welcome to the show, our final show of 2021.
It is hard to believe.
It is hard to believe, and actually, for the next couple of weeks, we'll be playing Santa Claus and that kind of thing. But, but it is our final live show of the year here. We'll be doing best ofs for the next couple of weeks as we wind down for the holidays, Dr.
And we'll
Molly.
be back live with all kinds of new info.
That's right, in January. Right, January 9th is our first new show of the new year. 2022, it sounds like it's in the far distant future, right?
It isn't.
It's only a couple weeks away.
No, it's a couple weeks away. And John, you know, I don't even want to think about how many shows we've done together.
I'll bet you it's close to 1,000.
I bet you're right.
Yeah.
Isn't it hard to believe?
We've been doing this 20 years.
I know, and it's...
Well, I was 10 and you were 11.
Oh, yeah, of course. Aren't you sweet? Maybe
anyway,
in our minds. Okay.
Good morning and welcome to the show. Health Watch every Sunday, 8 till 9. Talk Radio 1210 WPHT. I'm your host, John Damazzi. As the man said, Dr. Molly Fantasia is here. She is the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. And as always, we're here to dispense some great information about you and your family and your overall health. And as always, if you have a question, 855-839-1210 is the number here in the studio, 855-839-1210. Questions or medical challenges you want to run by Dr. Molly, feel free to do that at 855-839-1210. We do want to talk about, Dr. Molly, we want to talk about, and I know that we have mentioned this just about every show, but what you do, but how it is different from what people think that you come into this and it's, well, I had a hangover and I'm going to get a drip and then I'll feel fine.
With us.
That's not what you do.
No, we are a licensed primary care facility, so all the healthcare providers work out of our clinic, and we can do anything that a normal primary care office can do for you. And I think actually we can do it better. So that's the first thing that separates us. But what we believe in, John, is we believe that we'd like to augment the pharmaceutical. So if you come in and you have a sore throat and you need an antibiotic and you have strep throat, well, of course, we can give you the antibiotic. Our wonderful medical director, he'll write the script, send it into the pharmacy, you're good to go. No, not really, because what we want to do is we want to augment that script with some natural products that in kind can actually help you get through this problem better and in better shape.
So you augment it with the natural products, and obviously there's a lot of them out there.
Oh, yeah.
But it's specific to their condition, right?
Right. And here's the deal. We deliver these natural products by hydration. So we're able to give you a big bang, and it actually helps you get through a particular situation a little easier.
All right. So
less side effects.
Less side effect. That's the key, because we always talk about this, the pharmaceutical commercials. And again, we're bombarded with it this weekend.
Oh, my goodness.
The disclaimer is longer than the commercial.
Right.
And there's side effects with the pharmaceuticals.
Exactly.
And what you believe in, it's true that with the natural products, minimal side effects, correct?
Minimal side effect. Look. Anytime we take anything into our bodies, we can have a side effect, right? We can be allergic to it. Maybe you just don't feel well to it. So these kinds of things are necessitated that you do this kind of thing in a medical hydration clinic, which is what we are. So, yeah. And I will tell you, you can go into the health food store, and I've had people tell me, oh, but Dr. Molly, I can go in and pick up the same product and do what you do, and it's better. Nope, not really. Got to have some good advice. Sometimes it's good. Sometimes it's mediocre, and sometimes it's really bad.
And you have said, and you told me once, about a product I brought to your attention.
Oh, my goodness.
You said, well, yeah, you don't have to worry about anything after you take that because you won't be living. You know?
That's right.
It was like that kind of thing.
Because it interfered with the traditional meds you were on.
Exactly.
So, look, you need some good advice, and we're seeing in 2021, we saw a surge in natural products, which is great. I'm all for that. But I'm telling you that the delivery system is equally as important.
And why is it that it's delivered via hydration? Is that because that's the most effective?
It's the most effective in that the body can actually utilize it more quickly because it's bypassing your digestive tract. It's going exactly to where it is. And if you come into our clinic, we actually have very specific extracts so that the body can actually delineate that they are natural in nature, meaning we actually extract it from food product.
So taking a pill then is not as
you
effective.
lose so much.
Right, exactly.
You lose so much. Look, everything we eat that goes through our digestive tract, we're losing. And today, more and more.
Yeah. Okay, so let's talk about a lot of the different natural substances because people hear, oh, well, this is good, that's good. And then, of
Yeah.
course, their neighbor says, well, I take that, and then they take it.
How about it? Let's talk about that. How about people come in with suitcases of pharmaceuticals and an equal number of nutraceuticals or natural products?
Right.
And then you look at this, several of the natural products, several hundred of them actually do the same thing, work on the same area. Why not streamline the process? Come in and get some really good advice.
And many times people do that.
Oh, they
and
do.
then
Oh, they-
you go over it with them and you go, well,
Oh,
look,
my-
what
look
are you
at-
taking this for?
That's right.
And this does the same thing as that.
And how about the product quality? That's a thing I'm very, very upset about because just like there are generic pharmaceuticals, there are generic nutraceuticals. And some of the time, they're not good.
And I know that your nurse, Barbara,
Yeah, sure.
is pretty much an expert at this, and she can recommend things to take. And you don't sell any
Very
products.
little. Very, very
So,
little. Sometimes we'll take
y-
something in for
You
somebody.
can direct patients
Right.
to that, and that's why you said advice is important.
Yeah, you got to go to a knowledgeable person. I do have a wonderful patient who's very knowledgeable, and he owns a health food store. So we can talk about that at a later date. But the bottom line is sometimes you hit the jackpot on these health food stores, and sometimes you don't. Look, lately, the drugstores or the pharmacies, as they like to be called today, not to be confused with drugstores, look, they now are saying that their pharmacists are now educated in natural products. Well, I would say they must have had the pharmaceuticals for dummy course because they just started educating them and now they launched it.
Now
So
all of a sudden they're experts,
Yeah,
right?
they're all experts. And, I believe there are some pharmacists, gosh knows, I am very grateful to my compounding pharmacists, but there are some guys and gals who are really educated in it, and some I'm sure just read the Cliff Notes. So it's all good.
So help us understand that what you're doing obviously supplements,
Yes,
the pharmaceuticals
sure,
and that
sure.
kind of thing. But why is it beneficial in the long run? Because people are educated to say, "Oh, well, the pharmacist that's the best."
Oh, I'm
So,
sure. Listen, and in many cases, it is the best. The pharmacist is probably one of the best allies I have. My compounding pharmacist is one of the best allies I have. But there are, just like in the health food stores or anywhere, your clerk is only as good as the person who's telling you what to do and only as good as the products they carry. Look, no health food store or pharmacy is going to carry every single brand. They're not going to do
Right,
it.
they couldn't do it, right.
You can't do it. And so what I'm saying is get your advice from a medical facility who really has been doing this for 25 years, 26 years.
Right, and you also have medical doctors on staff.
Oh, my gosh, yeah.
so,
And I
mean,
also have very, very intelligent nurses on my staff. And I also would tell you this, that I would say that we also get to know you, the person, which surely makes a lot difference. I'm not a 5-minute encounter with you guys. You know that.
Well, I know that, yeah.
Okay? So we really put together a program individualized for each individual patient.
How many times have patients said to you, "This is like a family here"? How many
It
times
is.
have
It
they
is.
said that?
It
you know?
is, and the family's growing, but it's still a family.
Right.
And I would tell you that we take on all of the family problems. What we want to do is make sure that our patients are getting the best that they can get in their bags, as well as going out elsewhere and purchasing the products that we recommend or that are recommended to us. So that happens too, It's a two-sided thing.
Absolutely. We're coming up on our first break of the morning. This is our year-end review, sort of, and our final live show of 2021. Health Watch is the program, Sundays 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, if you have a question for Dr. Molly or you want to run by a particular medical challenge you're having, 855-839-1210 is the number, 855-839-1210. Again, the show is Health Watch, every Sunday 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm your host, John DeMasi. We both return. More Health Watch after these words. Welcome back to Health Watch. As always, operators standing by at Innovative Medical Associates, and you can contact them right now, 856-489-0505, 856-489-0505. And I know it's a holiday week, and next week is a holiday week, and you're thinking, well, I'll wait till after the holidays. No, they'll be there for most of the next couple of weeks.
I would say,
You're off Christmas Day and New Year's Day, right?
We're off Christmas Day, New Year's Day, and I'm giving all Christmas Eve.
Right. Okay.
Christmas
So
Eve.
other than that, I mean, you can make
Monday,
the call.
Tuesday, Wednesday, and Thursday, we're there.
That's right.
And
That's right.
actually, the phone is answered even on those days.
That's right. So you can call and you can make your appointment to sit down with Dr. Molly. The initial consultation is complimentary. And again, that number, 856-489-0505, 856-489-0505. Don't forget about the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And you heard the commercial during the break about Dr. Molly's skincare line. There's a great idea for a holiday gift, huh?
Look good on the outside
exactly
and the
right.
inside.
There you go. So check that out as well. InnovativeMedicalAssociates.com is the website. And again, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio. We always tell you call early so you can make sure you get your call in. We have plenty of time to talk to you. And we are talking about the year end. I guess, Dr. Molly, besides COVID, what were the big things in 2021?
Well, we all know autoimmune, and I think it was driven by a lot of the new drugs that are out that affect the immune system and, maybe shut off the immune system. A lot of the IV drugs that are very, very, very super expensive, maybe $20,000 a shot, that kind of thing. So I'm seeing a lot more folks who come in for some advice for autoimmune, particularly autoimmune-related pain, arthritic kind of conditions. I'm seeing an amazing increase in autoimmune conditions like lupus and MS, also neuralgia kinds of things. And, I find that interesting because I believe there is a connection to environmental medicine for lots of those. Of course, I'm seeing people hopefully getting a handle on cancer care. I'm seeing so much more of that. I have 2, 3, 4 patients right now who are in the throes of cancer treatment, as in conventional treatment, and realize the value of doing the supportive care in order to keep them going through the cancer treatments. And again, I want to say I appreciate how educated my patients are in becoming in this, because there's a lot of oncologists out there who are not quite as educated as my patients. Believe it or
that's
not.
true. Yeah.
Because again, this is the kind of thing that affects you personally, and you get off the stick and you start reading. So I'm seeing that kind of increase. I'm also seeing an increase in depression. Of course, that's directly related to COVID.
Right, yeah.
And of course, the COVID challenge that has certainly overwhelmed my clinic in the last, I would say the last year. And you know what's interesting, John? I'm seeing a resurgence of the COVID panic in
Yeah.
people right now.
Yeah, I see that too.
Cancellation of games and this and that. So, of course, the fear has been elevated. So we're seeing some challenges with neuro conditions and neurodegenerative conditions. And I want to give people an update. You've heard me speak about my PSP patient
Yes.
who is doing rather poorly. And I'm not saying she's not running a marathon. She's still having problems swallowing, etc. We treated her this past week. I didn't treat her, but I supplied the nutritional aspects of the program. And it was interesting. Her husband texted me and said, you know, she perked up a bit after this. He hadn't brought her because she was getting some home care for quite a while. And he said, wow, you ought to see this, Dr. Molly. So I was happy to hear about it.
Talk about the importance, and you've often said this, about the immune system and keeping the immune system as strong as possible, and the things that you do to do that, is particularly with cancer patients.
Cancer patients, the supportive care is so important, because we know lots of the new cancer drugs, even though they're immunotherapies, you know, we're sort of fooled by the name immunotherapies. I had a patient come in and say, "Oh, that's going to strengthen my immune system, right?" No. Many times, what it does is it goes after the cancer cells, but it also has a kind of effect on the rest of your immune system as well. So, yeah, I would say that the supportive care is very, very important. And we know that good nutrition is extremely important. But, you know, it's sort of an oxymoron kind of situation with cancer patients. Many times they can't eat, John. So they can't even get the nutrition that we can supply in an IV therapy.
So that's why it's important.
Yeah,
your cancer support system is important.
Very important. Also, the same is true for a lot of GI problems. You know that. I have seen an increase in that. Now, is that because people are more anxiety-ridden over COVID? I would say so. So they're having more GI symptoms, but some of them are bona fide conditions like Crohn's and Crohn's disease, and we're seeing more and more of this, inflammatory bowel diseases. So there are so many different things that IV therapies really help.
Besides COVID, what was the number one challenge that you had this year?
I don't want to say challenge was particularly from
all of them are challenges,
all of
right?
them are challenging, but in addition, I mean, patient challenging, I would say the autoimmune cancer, and I would just say overall the COVID situation has been an overwhelming thing, because it affected each and every patient who has the original condition. This became overriding.
Right.
I need to make sure I take care of myself to not get COVID.
All right, talk about an organization you were mentioning to me before the show, the Alliance for Natural Health.
I am a member of this organization, and I would like all my listeners to look it up. They actually put out a position paper on COVID. Now, the Alliance for Natural Health is a lobbying as well as information alliance of healthcare providers and practitioners who support utilizing natural medicine, integrative medicine, meaning both conventional and non-conventional. Their board is made up of very, very fine scientists and physicians, one of which is the woman who actually did the initial work in the use of vitamin C and became chair from the University of Kansas Medical Center for the use of vitamin C. But I was extremely struck today that the Alliance for Natural Health put out a COVID 411 position paper on what people should be doing. Of course, look at this kinds of things we did when we were 5 years old, hand washing, etc. But they actually give a list of every natural products that can help a patient through prevention of COVID. And I thought it was worth mentioning. And in this position paper, they go on to say that there are many natural treatments, natural integrative medicines that have been used to great effect for the COVID, which is interesting because these people are physicians and scientists. And that's why I love this organization, because I'll tell you, FDA is making it more and more difficult for the compounding pharmacy folks to actually get the ingredients we need to continue giving people good health.
This is one of your go-tos for advice.
This organization
this
is one of
organization,
the go-to in terms of letting me know what's on the horizon and to what will affect clinics like mine, which are not many, by the way. Not many. But we're out there, and we really want to tell people that, again, we must be proactive in our own health. For example, they mentioned things like melatonin, selenium, vitamin D, of course, beta glucan. Many of these things I use through the hydration and along with the vitamin C. So I really want people to pay attention, and if you can give $20 to them, I think it'd be well worth it. I am definitely supporting them economically as well as touting the fact that they're out there.
Talk also about another one of your go-tos, the Cleveland Clinic.
This is very interesting. One of the things I'm doing, what I find in the end of 2021 is that all the new kinds of technology that has come out, and I'm a laboratory scientist, so that just rings my okay bell that when I see this kind of thing. So we've actually partnered up with the Cleveland Heart Group, which is a laboratory process. We are offering the Cleveland Heart laboratory testing to my patients come 2022. In particular, for my cardiac patients, which I've been involved with cardiac through chelation
from day one.
Right. Now, this is another tool in our black bag because it not only separates our lipids into fractionation, which means I can get more specific with the integrative products. It also can help a patient in their conventional setting by bringing it to their cardiologist and showing them, hey, what other medications can I use? Look at this, look at that. And I will educate the patient in what the test means, how the test is used. I believe the test is approximately 5 to 9 pages of results for a particular patient. From the perspective of my clinic, we are going to use that information to get more specific about the anti-inflammatories, to get more specific with the chelation protocols that I use for each individual patient. So, for example, if the triglycerides are higher, we're going to look at all the substances that it can affect the triglycerides, not just the plaquing.
So, in 2022, you're going to be doing some things you've been doing, but you're also adding some
Correct.
things.
I'm going to
we'll
add
talk
more
about
technology
that after the break.
Right.
Because you're adding more. You added technology this year.
Yes.
And now you're adding more this coming year.
Well, I like the laboratory technology that's out there. Also, there's going to be a role of laboratory science in personalized medicine. I see it that way, having worked in the laboratory, in one way or another my whole life. I also want to look at this in terms of my cancer patients, looking at all the new cancer markers that are out there for my cancer patients. So again, and the use of those to help manage the supportive care.
All right, we're coming up to our halfway point of the show, and it is Health Watch, of course, every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. And again, our number here in the studio, 855-839-1210. We always tell you to call in early because we don't want you to get shut out. And being this is our final live show of the year, well, won't be talking to you live for a couple of weeks. So give us a call, 855-839-1210. That's 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return more Health Watch after these words. Back here on Health Watch, as always, operators standing by at Innovative Medical Associates. 856-489-0505 is the number. 856-489-0505. And as I said earlier, don't think because we have a holiday period that they're not working. They're there pretty much every day, except for Christmas Eve and New Year's Eve, and Christmas Day and New Year's Day, of course. But you can call them, 856-489-0505. Make your appointment to sit down with Dr. Molly. The initial consultation is complimentary, and all you have to do is sit with her and you go over your situation, and she'll be happy to kind of give you an overview. And then from that point on, you'll be able to make a more effective and intelligent decision as to whether or not you want to move forward. Pretty simple. 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com. One thing I want to mention before we get back to the show, you've got this last minute, well, what am I going to get so-and-so? Dr. Molly has a new book. It's called God's Ingredients TOO, My 30-Year Journey in IV Nutritional Medicine. And if you want to give somebody a little nudge as to getting them started on their improving their health, get the book, give it to them as a gift for the holidays, and who knows where it'll go from there. God's Ingredients TOO, Dr. Molly's latest book, My 30-Year Journey in IV Nutritional Medicine. A good read and informative as well. 855-839-1210 is our number here in the studio. If you have a question for Dr. Molly, 855-839-1210. Speaking of resolutions in health, so if someone said to themselves, listen, I got to get this, I got to get my health straightened out. So where do they start for 2022?
Well, certainly I would like them to come in for the free consult, and let's talk a little bit about what kind of conditions are bothering them in terms of the underlying condition and what other kinds of things. I think that's number one. The other thing is I want people to realize that the rate of chronic illness in this country is actually putting us more at risk, not to mention all the new nutrient depleting kinds of issues that are out there. The environment is doing this, right? I mean, we think things are wonderful. Look at my COVID patient. Wonderful guy. He's doing great, by the way, Tim, right?
Yes.
Doing wonderfully, I'll tell you. But his comorbidities, the exposures to the refinery where he was working. So up until he got hit over the head, right, to
Yes.
say, oh, he never even mentioned it. Never mentioned it to his wife. Okay, not just to me, never mentioned it to his wife. Here's the thing. The thing is, you got to think about your nutritional status every day for the rest of your life. Anti-inflammatory. The inflammatory process is attacking us from every angle, right?
And I know you wanted to talk about this, and it kind of goes with what you're just saying, the root causes of inflammation and disease.
Right. It's the chronic conditions, the stressors. Every time I hear a new COVID thing, you don't think there's more stress involved in that?
Absolutely.
What do you think's going on? What are you doing?
Right now.
Right now, they canceled the Eagles game. A thing that is so simple to take your mind off of the rest of your challenges. Now you don't have it, right? I mean, come on. They were canceling what? Canceling church services. Things where we can go.
How about Radio City? They canceled the
Right.
Rockettes.
Let's think about these things because they were the things that helped us. Look, folks, I'm a big believer in gratitude. I'm in gratitude not only for my patients, but for my suppliers, from everything that goes. Every day, I make it a point to do a 10-minute prayer meditation before I start the office. And my lovely Linda can tell you that because you can't bother me for 10 minutes in my office while I'm doing my prayerful meditation. That includes gratitude for another day of hopefully keeping all of these folks in good shape, making sure that I don't miss anything, making sure my discussion with the two physicians as well as the other healthcare providers is to the point, and I'm not missing anything for any patient. And I think we all need that. We need to start bringing gratitude back into our life. We need to start looking at other things, our food intake, our drink. Listen, I'm a Christian woman. I'm a believer. So we know that there's no real deal about wine. You can have wine, but you can't drink 3 bottles in a sitting.
That's right.
I'm also an Italian. I've seen a lot of people overindulge. I think we've got to start looking at our food. We got to start looking at eating more in the way of healthier. I think people should start really sitting down and saying, what are my priorities in life? In terms of my health life, are we going in the right direction? Because quality of life, in many cases, and I've seen a lot of cancer patients at stage 4, and I would tell you that not one of them come in saying, I'm looking for a cure. They're always saying, Dr. Molly, can you give me some quality of life that I can have some time with my folks?
And you've done that for many cases.
Absolutely. And I think it's something for us while we're feeling good ought to think about. We need keep your own health in check. And one of the ways you do that is through IV nutrition.
So let's say somebody is listening to this and they're saying, well, Dr. Molly, I feel okay.
Yeah.
But I could feel better, I guess. So what do they
Not
do?
you guess.
You
telling
can,
you.
yeah.
Yeah,
Okay.
you can. You want to come in. You want to have a complete blood work drawn. You want to have metabolics checked. If you have a history of cardiac, maybe we should run genetics. That's the other thing. We're doing so much in the way of genetic testing. The idea is utilize the proper genetic test for what the patient needs to get done. I'm a big believer in that. We have a test that can tell us about the antidepressants you're on. It can actually help the psychiatrist give you an antidepressant that is just for you. I don't believe in throwing away your antidepressants.
So the answer is maybe not just going into the health food store and saying, give me a bunch of things for depression.
No. Let's look at where we are. And also, I have an IV treatment protocol that may help you feel a whole lot better and help in this thing. And if you get on the right antidepressant, you might be like a new person. So it's the combination, right?
Well, you go into a health food store, and if you ask that question, well, what do you have for depression? How many different products,
Listen,
right? And how many?
Start with B vitamins.
Right.
People say, oh, well, you just need some more B. Okay, yeah, that's probably true. But we need the right form of B. We need to make sure that you can utilize the B. You need to make sure that you're not overtaking some of the herbal stuff. There's so many things you got to look at, John.
Can you give us a little sneak preview as to what's going to be new and innovative in the new year?
Well, as I said, we're going to be doing a lot more. We've always been big believers in the laboratory science, and I think right now I'm actually, and of course I've developed a couple new protocols. I tweaked some of my older protocols for what's available right now, and actually it's very interesting. This week I told everybody, listen, I'm a big believer in frankincense, right?
Yes.
Okay.
Yes.
And why? It's not necessarily the frankincense that I'm talking about. It's the constituent in the frankincense that I know has an anti-inflammatory property. So again, what we're doing is I'm not just throwing nutraceuticals at you. I'm looking at the constituents and how they all go together for your particular challenge.
We should also mention, and we've mentioned it often, but for those who may be listening for the first time, that you are a scientist by nature.
I'm by trade, absolutely.
You have 2 PhDs, so you are a scientist who is constantly thinking about what I can do to make this better, right?
But my focus has always been on God's ingredients because I believe there is a multitude of natural things out there that God has provided us. And, I laugh about it. Look, I have a honey right now. Now, this is one of the few things that I have in stock. I have a honey from the Holy Land. There was scientific data that was sent to me from Israel, from the scientists in Israel who developed the honey, showing how it improved the white blood cell count for cancer patients while they were going through chemo. That is what I live for.
Isn't that fascinating?
It. And I looked at it, and I looked at the constituents of the honey, how they did this. The bees were sequestered in certain areas. I got to believe it was the Garden of Eden, right? It's the land of milk and honey, isn't it?
Yes.
So why not? So there you go. That was one thing. I look at all of these things. I look at extracts. I love regenerative medicine. I love that. I love the idea that we might be able to get someone out of pain by giving them a shot of their own platelets and growth factors. I love it.
And you've had many patients who you've done this for.
Exactly. But I also have an IV protocol that goes along with it. We're preparing the body to accept this. So there are so many ways that I believe we are going to move ahead. I'm doing another exciting project. Once every quarter, I'm a guest speaker at a college for new nutritionists who are coming out with advanced degrees in nutrition, because I believe there's a real place for nutrition in our life, not just the IVs, but utilizing the products in a proper manner. And you need people who are educated in that.
And I know you work with a nutritionist too.
Oh, yes.
Right.
Oh,
so
yes. She refers
you cover
to
all
us.
the bases.
We try to. And again, I think it's very important that we look at the data. I love data. Can't help it. I love the data. So I don't want to go down I don't want to go down pathways that don't have an application for my patients, meaning, or our patients. I guess they're not really my patients. They're my medical director's patients. But the bottom line is, I look at this and I say, what can I do to help folks in their own journey to have better quality of life?
And we will pick up that thought after the break. It's our final break of the morning, which means you still have time to get in here with a question or a medical challenge you want to run by Dr. Molly. 855-839-1210 is the number, 855-839-1210. Our show is Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT, with Dr. Molly Fantasia. I'm John DeMasi, coming back with more Health Watch after these words. Oh, we're back. We have quiet music to start us back off. If you'd like to contact Innovative Medical Associates, and whether it's today or tomorrow or during the week, 856-489-0505 is the number. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. Feel free to call if you'd like to make an appointment or whatever you want to get more information. Whatever you want to do, feel free to do that. 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. Don't forget, if you miss any of today's show, we have our Health Watch replay. That's this afternoon from 4 until 5. It's today's show this afternoon. Our Health Watch replay 4 till 5 every Sunday right here on Talk Radio 1210 WPHT. This is our live version of Health Watch every Sunday, 8 until 9. We're going to go to the phones. Kathleen is in Lansdale. Kathleen, good morning.
Hi, Kathleen.
You're on with Dr. Molly.
Good morning.
How are you, Kathleen?
Good morning, John. Good morning, Dr. Molly. I recently heard that depression and chronic inflammation go together.
Yes.
And I wondered if you could maybe explain that.
Sure. It's when you think about it, what happens is with the chronic inflammation, and again, we're talking about systemic inflammation. We're not just talking about what's going on in our head. What happens is that there is a dysregulation in the hormones, the neurohormones, neurotransmitters. And so the live wires, so to speak, start miscommunicating. I'm a big believer. Now, I'm not saying that we do have a protocol for depression. I believe in using things like NAD. I believe in using, of course, vitamin C and several other products that I put together. But I also know that during depressive situations, and we have to be very careful. I really, really worry about our patients that they're on the wrong category of antidepressant, which is why we use a particular test that we send out that is absolutely covered, that actually lists the drugs that may be more effective for one patient than another. And a lot of that has to do with the biochemistry and the genetics of the patient. So can depression be helped with nutrition? Absolutely. I think many times it might need a boost with a pharmaceutical. But I also know that if you use the right pharmaceutical, you don't have to bombard the patient and make them lethargic, etc. So yes, there is. You really need to look at inflammation markers systemically, not just brain markers or the neuro markers. For example, like the serotonin, GABA, that kind of thing. Yes, you want to measure all of that, but there is more to it. And so I agree with you, Kathleen. There is a connection. Thank you.
Okay.
Thanks for
Thank
the
you
call.
for that.
God bless you.
Thank you, and Merry Christmas, Kathleen.
Yeah,
Thanks
and
for the call.
many more. That's a very interesting case because, again, you're looking at the hormonal relationship. I've seen a lot of depression through COVID, post-COVID.
Speaking of COVID,
Yeah.
and I know you want to talk about the men's health and the
Yeah.
men's health protocol, but people are so bombarded now with this thing.
Sure.
What do you suggest people do? Obviously, come in.
Right.
And I mean, I get vitamin C,
Listen,
and I feel
know
that's
that. I
very
know.
good.
You know, it's so amazing to me because we need to use good health habits, like I said before. But the vitamin C and the other ingredients I use in our COVID protocol, it's out there. I'm telling people, we're helping people through it. I had a whole family come in this week. The mother was my patient. She brought in her daughter, her son-in-law, all chiropractors, very intelligent people. We treated everybody. Thank God our medical director understands this, and he said, go for it. and we treated the entire family. Now, with that being said, interesting thing about post-COVID, you've heard me talk about the long haulers.
Yes.
People should see us if they're not feeling quite right after the COVID exposure, because there's a lot of data now to support using some of these nutraceuticals afterwards and a whole post-COVID protocol. One of the things I want to talk about is I'm finding very interesting data on my male patients. Men tend to have post-COVID, they tend to have dysregulation in their testosterone. So you know the kind of problems you can have with that.
Yes.
And also, I just read a brand new study that says there can be damage to nerve cells post-COVID. They're seeing that in some people. Well, add that to a hormonal dysregulation, and you've got yourself a real recipe for ED and those kinds of issues, which we can help with. So again, I think the idea is don't just stay in fear for COVID. Let's get together, maintain our health. We all know that, it's out there. It's affecting us. It's affecting men one way, women another way, but it's affecting each and every one of us. So I would say, come on in, get some IVs. I'm telling you, it'll make a difference. And it makes a difference, the kind of products that we use.
Speaking of men's health, you started that in this past year, and you'll continue that.
Absolutely.
What is involved in this?
Well, we use chelation as well as the acoustical wave, because we believe that you're never going to have the results on the acoustical wave permanently if you don't clear up the plaquing as well as the scar tissue. So it's one of the ways that by which we do things a little differently. Most of the men who are doing this are having interesting effects. I want to have one on after the new year. They're doing pretty well, and it's fairly quickly that they're starting to see effects of this. So I'm happy with it.
And you've had, as you said, you've had a lot of men who have undergone this, and you'll continue to do that.
And I definitely continue to do that. And again, it's part of our hydration protocols as well.
Okay.
So it's not separate.
We have about a minute, so I know you wanted to say some thank yous and all of that.
I want to say I have an extreme feeling of gratitude to all the patients that put their trust in all of my medical providers and myself throughout this year. And I want to realize that, they have helped us realize the value of good health. I can't stress enough how important it is to say thank you to all of my patients for being smart and for researching and doing and putting their trust in us. And God bless each and every one of them through their journey.
And of course, Merry Christmas, Happy New Year, and we're going to be
blessed Christmas.
Blessed, and we'll be back next yeyear.
We will with God's help,
bigger and better, right?
Well, with the good Lord's help. He's the big doc.
Okay, if you have a question or you want to make an appointment to sit down with Dr. Molly, your New Year's resolution is to get healthy for 2022. 856-489-0505 is the number. 856-489-0505. And don't forget, we replay the show this afternoon from 4 until 5, the Health Watch replay right here on Talk Radio 1210 WPHT. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. With that, we put the wraps on another edition of Health Watch. Want to thank everyone. The lovely Linda. Happy birthday, by the way. Happy, lovely Linda. She's 100 years old. Barbara, delightful D, fabulous Fran, Joanne, and our nurses Jess and Lana, and our medical assistant Karen Kathy. I'm your host, John DeMasi. Thanks for listening. Merry Christmas, Happy New Year, happy whatever holiday you celebrate, and we'll talk to you next year. Health Watch right here on Talk Radio 1210 WPHT.
This program is a paid commercial announcement and in no way represents the views of